Well, we'll go ahead and get started. I'll introduce myself. I'm Debbie Bebo, and a little bit about me. I'm the owner and instructional designer of ClinEdWeb content. My clinical background is in occupational therapy. I was a full-time faculty at the University of Wisconsin-Madison for about 16 years, and recently I transitioned to Madison College's Occupational Therapy Assistant program. The intention of the ClinEdWeb is to provide an interactive, dynamic learning tool that demonstrates techniques, assistive technologies, inter and intraprofessional collaboration, and clinical reasoning. Essentially, it's the day in the life of an interdisciplinary practitioner. So we shoot video of expert clinicians working with real clients to maintain authenticity and adhere to the best practices of virtual simulated learning. And there are pre-briefs, formative questions, debriefs, and documentation embedded in the scenarios. Luke, do you want to introduce yourself?
Sure. Hi, everyone. My name is Luke Bebo, and my background is in assistive technology. So if you've heard of a group called RESNA, I've had my RESNA credentials for over 20 years. In addition to that, I've also done project management for software solution implementations, such as portals and learning management systems. And I also have skills in video production and editing. So we've combined our skills to bring this to existence. And so what I did is I took screenshots and made some video clips to give you kind of a relatively brief presentation. The case that you're looking at to go through the whole thing would take several hours. And so we're going to try to condense it to be mindful of your time. Okay. So ClinEdWeb provides virtual interactive case scenarios. And before we go into showing you what we have, we wanted to get a little bit of an idea on what some of your needs might be. And if you look at the screen, there's a list. And we want to see if any of those items resonate with you. If any of those may be something that you need, or if there's anything not on this list, we'd just like to understand that before we get started.
Definitely the documentation exposure and practice seeing other professions is really important. Having a simulation platform that is relevant to what our students and interns will be doing later on in their careers, and being able to see that transition from their current academic work into the workforce.
Okay.
Wonderful. Thank you for sharing that, Michaela. I will tell you that this came out when I was working as an academic fieldwork coordinator and an instructor at University of Wisconsin-Madison. And I was wanting to bridge that gap between didactic coursework and their fieldwork. And that's when I completed a pilot study, actually, and then I went back for my doctorate, and that's what I studied, was looking at these virtual interactive case scenarios, and really found a positive correlation, not only with knowledge acquisition, but with self-efficacy, and students really having a better understanding and feeling more confident about what it really looks like out there in the field. So I appreciate what you're saying.
Ashley or Benny, anything sticking out for you with this list?
I'd say, also given a newer shutdown that we're dealing with now, trying to get the students more exposure in different types of ways without having to in-person see patients. So just more outlets to create opportunities for them to learn through different cases and things like that. We also, have a couple other professions, a PA program and a pharmacy program at our university too, but not really, we don't have an OT on staff in our low vision department. So it's something that as a low vision provider, I would love to also be able to provide to the students and give them that idea about how we interact with other sorts of professionals as well.
Wonderful.
Yeah, and as we move into requiring it for accreditation for optometry schools in the future, that's another thing that we're definitely looking at, because PA and Pharm are programs, they do require it for their accreditations. For us, it's always been kind of like, on the back burner, but now it's being pushed to the front, and we're definitely seeing the need for it.
I can appreciate that as well. That was one of
Right.
the big intentions with this case, was to show that interprofessional aspect. And this team we teamed up with Vision Forward, and I feel like they are a best practice example for students to look at. Just as an outsider, I have no affiliation with Vision Forward, and their team works together amazing.
And you'll get a little highlight of that through the video clips that we put together. So thanks for that information. That's really helpful. And then we're just going to go ahead and proceed. Feel free to stop us at any time. Okay, so we're focused on our interprofessional case, and you can kind of see the team. The only one missing from this picture is the OD, but we'll see her soon. And so this is just a list of some highlights from what's in this case.
So in this case, the learner follows a real client as she receives comprehensive assessments from a myriad of professionals, including 2 occupational therapists, the optometrist, social worker, orientation and mobility specialist, the Braille instructor, and the assistive technology specialist. The learner watches an interprofessional staff meeting as well and answers questions about its intention and benefits. And then interprofessional OT, OD, and social work accreditation standards are addressed throughout the scenario. So you'll see little asterisks that point to that and how this is meeting those different accreditation standards.
Okay, so we're going to take you through a little bit of the learner experience, and whether it's your student or the faculty, everyone has their own account, and several of you already have accounts set up. So you would just log in to your account at our website, ClinEdWeb.com, and then you would be presented the content that you have access to. And so here again, we're focusing on the interprofessional case. So you would just click on that, and then you would enter the case, and it starts with a simulation, pre-brief, and instructions.
So in the pre-brief, there are instructions and text that immerses the student into the context and the environment of the case, simulating the first day of an internship, as well as the overarching expectations to complete the case scenario. When I was studying the best way to create these interactive case virtual scenarios, there was a lot of literature around that it needs to, the character, the person watching needs to be one of the characters in the environment. And the easiest way to do that, I mean, when do we watch, a expert clinician with their clients, is usually when we're on our first day of fieldwork or first day of residency. So that is the context that the learner is immersed into. And then you'll see that we have that little symbol with the clinical pearl, and that's additional information such as peer-reviewed articles or other reputable information in the cases. And that way we're able to give students even more insight to the clinical reasoning behind the clinician's actions. And the feedback from the students is they love these, because even though they're seeing what the practitioner is doing, they're observing it, they might understand it, they've maybe seen the tool before or heard of it, but they don't understand all the reasons why they chose that tool or what safety rationales they're using in making their decisions. And that's why we embed that safety cue symbol with that orange cone, also to alert students to safety precautions and safety insights that the clinician may be thinking of within this environment.
And those are laced.
Sorry, go ahead.
Sorry. I was just going to say those are laced throughout in the questions and also in the videos, and in different, sometimes they're standalone just on their own. Go ahead, Debbie, sorry.
No, that's fine. And then after they're introduced and now they know the environment they are in and expectations, it's all kind of real quick on this slide. Then they meet the program director who's going to kind of take them into this case. So here the program director introduces the student to the importance of the interprofessional team and provides a couple of peer-reviewed article abstracts to support the importance of the interprofessional team in low vision rehab. So this is a perfect example of how we embed those clinical pearls that provide additional information.
Shina's coming in, so it didn't kick me out of my presentation, so. All right. Okay, here we're looking at one part of the chart.
So the learners are instructed to complete a chart review to practice gleaning pertinent information. So as Luke just said, this is just part of it. They'll walk through and see the requisition from the OD, precautions or medications the client is on, the social history of the client, work and education background, and past medical excuse me, history. And then that'll move into a chart review questions. And so after each learning activity, such as the chart review right here, the users asked a series of formative questions to ensure understanding of the content. All questions are multiple choice and may have one or more correct answers. And rationales are provided whether the student answers correctly or not. And they are provided with the rationale for those correct answers. So here, as Luke had mentioned before, we also embed clinical pearls. We might add in a document here to just augment the information. Like I think this question is about her diagnosis. So not everybody might know about her diagnosis or have heard of her diagnosis. So this provides a quick answer to that question.
And just to add to that, the learner is not penalized in any way for these formative questions, but they're tested out at the end, and you'll see we provide a summative exam at the end that they are scored on.
But they are provided feedback. So each of the quizzes, so there's a series of questions about the chart review, and they will find out at the end of that quiz what they got on that quiz. So whether it's 50%, 100%, 80%, they know how they did, and they can go back and retake that quiz. So it's interesting to watch the data that comes in on this. Many students, if they do poorly, they'll go back and retake that quiz. It might just be new content to them, and then when they get to something they're more familiar with, they breeze through that and score better. But the thought is those questions do help them learn. And then first they meet the social worker, and they learn more about the social work role in this setting and the requirements to become a social worker. And this is very realistic and authentic for this context. The social worker is the first person to meet with the clients at Vision Forward.
Okay, so I put together a video clip here, let's take a look.
Hello, Rebecca. My name is Erica Weiss. I'm the social worker here at Vision Forward, and I'll be doing an assessment with you today called Adjustment to Vision Loss. Okay. So the general idea is for you to tell me just how things have been going with you as a visually impaired person every day, how you're managing, and if there's anything that you'd like from Vision Forward in that regard, or anything that you think might affect your training. Okay. I will share with you that I have RP, retinitis pigmentosa, so I have a vision impairment myself. And what will happen is that after I've done my assessment, you'll be meeting with each member of the team. They all do their assessments. You got a lot of us to be encountering, but we hope then to have a full team to look at all the aspects of what you might need in your training from us. Okay. When we're all done, everybody has a report. You'll get a copy of that report, those reports, and then we meet for a staffing to go over those results and see if there's anything that we want to change. Okay. All right. Well, hello, Rebecca.
I move on.
Next. Oh, sorry, go ahead. What were you going to say, Luke? Go ahead.
Just teeing the slide up. Go ahead.
Oh, next, the learner meets the optometrist and learns more about the importance of effective interprofessional collaboration.
Okay, and then we also added here the lighthouse and a link there so they can look at, because it gets obviously very small at the bottom, and then the MN read, which are two of the items she uses. So we just provide that ahead of the video. And then here's a little clip.
Well, hi, Rebecca. My name is Dr. Hinson.
Hi.
So nice to meet you. Want to do a little
Sure.
fist bump? There we go. Nice to meet you. Before you came in today, I had the opportunity to review some eye records from Dr. Kim and Dr. Stepien. So let me just review that with you, and you can kind of add anything as we go along. So I want you to start out by just looking straight into the chart. Okay. Can you tell what the letter is?
I want to say probably a B.
Okay. And I'm going to go a little bit smaller.
Okay, I would say that's an E or an F.
Okay, how about here?
That could be a D or an O.
Now, if you try kind of looking around, up, down, left, right, is there any direction that you turn your eye where it's like, ooh, now I know what that is? Kind of trying to tap into your peripheral vision.
Well, maybe it's a G.
It is a G, nice.
Yeah.
So I'm going to have you put this frame on for me. There's no prescription in here. It's just kind of like a placeholder, if you will.
Yeah.
All right. You keep looking out there towards the screen. And I'm going to drop this in. All right, now, you may have to raise and lower your chin a little bit. Can you find the screen out there?
Oh yeah, that's a lot better.
Yeah, what do you see?
A T.
A T, excellent. What's going to happen next is I'm going to have a conference with Lauren, the occupational therapist who you're going to see next.
Okay.
And I'm going to let her know what we found, let her know how much magnification is appropriate for you,
Right.
and then she's going to get set up for you. Now, there's lots of tools available in the power that you need. And she's not going to get to show you everything today. You'd
Right.
be here for 5 hours if she was going to show you everything. So we kind of break it down into smaller, more manageable visits, so
Okay.
it's not so overwhelming. So she'll go through some of the stuff today. She's going to ask you a lot of similar questions that I asked about what's your goal, what is it you're having difficulties with, and then she'll kind of pick up where I left off and let you get your hands on the things that can enhance your vision. So I'm going to let you sit tight. I'm going to go talk with Lauren, and then we'll let you go in and work with her, okay?
Perfect. Thank you.
And as she segues very nicely for this, then we walked in and meet the low vision occupational therapy. And she is just one of the 2 occupational therapists that see this client. And the learner learns more about the OT's role and the requirements to become an OT, as well as a certified low vision therapist, which this Lauren is both a CLVT and an OT.
Hi, Rebecca. My name is Lauren. I'm an occupational therapist here at Vision Forward Association. So my role is to work on optical devices with you. Specifically, probably reading and writing is typically what people use optical devices for, but also to see things in the distance. Okay. So what I would like to do then is have you return to Vision Forward to work with me.
Okay.
And what we will do is I want you to bring your reading materials again.
Okay. Were you previously approved to receive testing accommodations on one or more?
Now, if it gets a little bit, if there's a word that's kind of, making it a little bit difficult for you to understand what the word is, there's a couple things you can do.
Okay.
You can make it bigger.
Right.
But what I would do is I would kind of go back just a little bit and glide the word across your eye again.
Eye again. Okay. One or more eligible tests.
There you go.
There you go.
And so next, the learner meets the Braille instructor and the orientation and mobility specialist. And this is a really fun guy that definitely had a very good demonstration of developing rapport with his clients. And also the learner learns more about not only his role, but the requirements to get those certifications.
So Rebecca, you're here today for an assessment for Braille.
Yep.
And I noticed from the notes that we had in the community that you'd had Braille in high school?
Correct. Yep. I had a little bit for a couple of years in high school, kind of went through the alphabet.
And we're just going to go from left to right and just tell me how many dots you're feeling.
Okay, so 2,
Uh-huh.
3,
Mm-hmm.
4.
Okay.
Am I going over? Keep going.
Yeah, there should be one more. Oh, I'm sorry, 2 more.
2 more. Yeah, I got to count here. Hold on. 4. And then 4.
Okay.
The
Mm-hmm.
cats
Mm-hmm.
hat.
This is not the most profound sentence, let me tell you.
Cat in the hat.
You're muted, Luke.
Thank you. And then he does the orientation and mobility assessment. So we have a little clip of that too.
You notice there's a flat part to the handle.
Yes.
All right, so turn that out. Grip the handle and stick your index finger down.
Down like that.
Mhm.
Okay.
Now, ideally, I'm just going to take your hand from it. Ideally, you want to keep it centered.
Okay.
And out as far as you can.
Okay.
So, we're going
Okay.
to come down this way.
Okay.
And what you want to do is when you're arcing the cane, just the wrist.
Okay.
Okay, so you keep the arm steady and just kind of like the tail of the fish.
Okay.
The tail goes back and forth, but the body stays. Yep, and just enough to cover the width of your body so you don't run into something.
Okay.
Okay? Have you walk down the...
Down the
There you
hall.
go. Mm-hmm.
Okay.
And I can almost tell from back here. You looking down?
Yeah.
Uh-huh. Yep.
Okay.
I know it's hard for low vision clients.
Yeah.
So we're going
Okay.
to turn left.
Okay.
But before we go, I mentioned, using those environmental cues.
Yeah.
So one of the best ones is the traffic.
Right.
Okay. So you're hearing it on what side?
My right.
Yep. So
Okay.
that lets you know that as long as I'm hearing it on my right side,
Yep.
I'm going in the right direction.
Okay.
If I suddenly hear it behind me or to my left,
Okay.
I made a wrong turn.
Wrong turn.
So let's go up to the corner.
Okay. Okay.
All right.
We want to stop when we feel these things.
Yes. Usually I'll tell the clients, like, when the tip gets just past it,
Past it. Okay.
that's just about the right amount of distance. So
Right.
why don't we have you just go back and find
Okay.
your way back to vision forward.
Okay.
With your eyes closed.
With my eyes closed.
Yeah.
Oh my gosh.
There, so great. So next, the learner meets the second of the two occupational therapists and learns more about low vision rehab for increased independence with activities of daily living. So the first occupational therapist was very focused on return to work activities and using the large magnifiers for the different, as she mentioned, for reading and for her materials for work and using her computer. And now this OT really specialized in her independence at home. And this, in this case, they really showcase very nicely low tech assistive technologies as well as very high tech assistive technologies.
My name is Rose. I'm an occupational therapist here. So this is called the Activities of Daily Living Assessment. So activities of daily living are the things that most of us have to do just to kind of get through our day. So everything from brushing your teeth, taking out your clothes, taking medications, cleaning your home, eating, making food, all of those important, what we call essential skills. So, and as you probably know, those tasks can be difficult to do with vision loss, or they may feel, sometimes impossible to do, right?
Right.
And then there's also a soup can that you'll be able to feel something on the top. Those little magnets you had probably when you were a kid.
Right. No, that's smart.
And that's a good way to
That's a
just
good idea.
quickly label something.
Yeah.
You have soup, S for soup or whatever,
Right.
whatever you choose. So let me walk through that and then I'll have you do it. So I'm going to hold down the record button, touch the device to the label. Blood pressure medicine. Okay, so we heard the first beep and the second beep. And then to listen, I just bring the device to that label. And then the middle panel, that's where our oven controls are. And this stove is nice where it has kind of a little border around where the oven controls are, so you can feel that border. Yep.
Right.
Yep, excellent. And then you'll probably start to feel there's some different markings. Yep, there's a little bump dot that you're feeling right there.
Right.
If you go over to the other side.
Yeah, that's like up and down.
Yep.
Yep.
And then finally, I think this is the last specialist she meets is with the Assistive Technology specialist and learns more about this specialty certification. And we also preempt with a little information on some of the technologies that he introduces to the client.
If you have the ability to turn up your speakers, you might want to do that because this is a little quiet and he has an accent.
Hi Rebecca, my name is Luke. I'm an assistive technology specialist here at Vision 4. And today I'm going to be working with you to identify some different types of assistive technology that might help to allow you to meet your goals that you have. I know that you've had a referral through from DBR, so we're going to write a report to them and hopefully get some different devices approved for you. Okay. Yes. It's designed to go on the side of a pair of glasses. And so there's magnets basically which would connect it to the glasses, and then you would be wearing the glasses. Now the glasses are just a mount, so they don't have a prescription in or anything like that. Right. It's just acting as a mount for the camera. The basic idea is while you're wearing the OrCam, you can look toward whatever text you want to read, and you can either point at the text and it will take a picture and read it, or you can tap on the side of the camera, it will take a picture and read it. Yeah. And the nice thing is because it's mounted down on the glasses, you can use it to read, stuff that you're holding in your hands, but also stuff that might be on the wall, or just wherever it is, basically. Let's give it a try. So I'm going to go ahead and hand you a document here. This is just regular size print here that you would normally get on a printout. And I want you to hold it about 3/4 arm's length with your left hand. That's it. Look toward it, and with your right hand, we're going to go ahead and tap on the camera. So bring the right hand up to the side of the camera. Just go ahead and tap there. So you're going to hear a click when you've got it. Perfect. You can hear it's reading the document. Now, we can actually place the document on the table at this point if we want. We don't need to hold it because it's taking a picture.
Okay.
And now we're going to go ahead and tap on the side of the camera a second time to stop the reading. Good.
And Luke, is it true in the actual case, it's easier to hear that it just did that when it got transferred to the PowerPoint?
It will be.
Yeah.
I got to do a little work on that. This one's hot off the presses, so.
All right, so this is next to the interprofessional meeting. So this is where the learner sees how the team works together with the client to come up with the best client-centered plan of care. And this is led by the social worker.
All right, well, this afternoon we're meeting to go over Rebecca's evaluations, the work that everybody has done. And so, Rebecca, maybe before we get started, we should do introductions around the table. Okay. I'm Erica Weiss, the social worker here.
I am Luke. I am the Assistive Technology Specialist.
And I'm Rose, Occupational Therapist. I did the Activities of Daily Living assessment.
I'm Steve, and I did your assessment for orientation mobility and for Braille.
I'm Lauren, and I did your assessment for optical devices.
So the whole team is here to meet with you to go over the evaluation results. I know that some of that has happened, but kind of bring us together as a team to do that and then make recommendations. And so please feel free to participate as you would like to. If you have questions or comments, don't feel like you need to wait. You can kind of be part of the discussion with us. Okay. Is there anything that you'd like to start with before we go ahead?
No, I don't think so. I think the assessments were really good and definitely learned about a lot of different tools potentially that could be useful. So definitely excited about that.
Terrific. Okay.
All right, so we took and we compressed several hours of material down into just a few short minutes. And so now we're nearing what would be the end of the case scenario. And there's a discussion forum debrief.
Yeah, so the students are cued to answer a few questions to provide a debrief or reflective experience, and they can also see what other students are writing in answer to the questions. And the questions we have in this case are centered toward interprofessional practice, and they usually do a really good job responding to one other student who is completing the case at the same time. And also you as faculty can go in and look at that at any time. And then finally, they sum it all up with the summative exam, which is 25 questions that are all multiple choice. They're very similar to the formative questions, but now we're looking, did they get the overarching concepts? Did they get some of the clinical reasoning? Do they really understand interprofessional practice? And once they pass that exam at 75% proficiency and they've gone through the entire case, now the system does keep track, and you can't just jump and take the exam at the end and hope you can pass it and then get a certificate of completion. The software does make sure you have to have answered every formative question. You've had to watch every video. You've had to have opened every slide, and then also have passed the exam at least 75%. And then they get the certificate of completion.
So the certificate will have their name at the top, and then of course the case that they went through. And then on the bottom left, it gives you the date. And on the bottom right, it gives you a unique identifier. So we know that it's legit. So how do you go about purchasing it? Well, there's two paths. One on the left side is the student purchasing, and the one on the right is the department purchasing. Statistically, it's about 50-50. So if you're worried about your budget, it's very common for students to buy this. We don't hear complaints. What we really hear is they can't get enough of this type of stuff. So keep that in mind. But on the left side, if you decide that you're gonna have your students purchase this, that little bit of copy there is what we'll provide for you. And that's all the instructions that they need. Okay, go here, click buy, and then pay for it. And at that second, they are in the case and, you know, starting. On the other side, if you decide as a department you want to provide that for them, we just need a little basic information like how many students, this type of thing. And then we just need to know how you would like to pay for it, so we can do whatever's convenient. We can do a PO or a check or a credit card. So then the payment gets taken care of, and then we provide you the student instructions. And the really only difference between the instructions on the left and the right, the one on the right, we provide you with a coupon for them because it was already paid for. So then they don't obviously have to pay for it again. So any questions on how to purchase? It's very straightforward. Okay, there's a chat.
There is no max. You can have as many students as possible as you have.
Did you read the chat?
Yeah, it said, is there a max of students at this time?
All right, thank you. Okay, any other questions on that part? Okay, that's the whole presentation. There's more that we can show you on the website, or if you go to that landing page for that case, it gives you the accreditation standards, gives you the whole curriculum. But before I go over there, what comments do you have and what questions do you have? Michael, I can say
you're watching my cues. I think I'm wrapping my head around exactly, you know, how we could incorporate this, what the utilities are for our individual needs. And when I was looking at the website earlier, I think under the low vision rehab section, it had like 60 lessons or something like that. That's kind of what we did a brief overview. So those aren't different cases. That's kind of what we saw an overview of today. Is that right?
Yeah, you saw a small portion of those.
Great. And then the other question I had was, if you do a program sponsored access to multiple students, is that a cost difference than if each individual student would go on and purchase the content themselves?
Yeah, if you're going to purchase as a department, and the threshold is 70. So if you have 70 or more students, then we will provide you with a 20% discount.
Okay, excellent. And is that needing to be utilized in a certain time period? Like, let's say over the next few months or 6 months?
Once we'll give you the coupons once you pay for it. And then right when they use that coupon, that's when their clock starts. And it's 120 days.
Okay.
So you can wait a month and then use the coupon. Then from that day forward, you have 120 days.
And from a curricular perspective, I would say in talking to a lot of colleges who have used this, the most effective seems to be wherever you decide it fits best in your curriculum, whether you're talking about interprofessional practice or they're about to go out on field work. I know we talked to another OD program that they're using it right before their students go out and are going to work with all these practitioners, or as I think someone here also mentioned, some of those practitioners are missing and they want them to be able to see where they would fit in another setting. I think they were in a very rural area where they didn't have access to, say, an O&M specialist, is to give the students like a 2-week module. So if you're talking about interprofessional practice or say something of the content that's in there, the MN read in your situation or the Lighthouse, then have, after they have that information, just have as homework, so to speak, to go and complete the case and upload that certificate of completion within 2 weeks. Then you know all your students are working together. We did have, there is one college that just gives them it and gives them the whole semester to complete it. And I think that leads to a very disjointed experience for the cohort if you have a cohort of students that are learning material together.
Debbie, can you see the website right now?
I can.
Okay, so I just wanted to show you, if you go right to the case and you click on it and then you scroll, like if you want to share this with colleagues, I do have a little video excerpt right here. Maybe some of you have watched that. And then you have a description. And then as you keep going down, you're going to see the accreditation standards, the whole curriculum and the learning objectives. So you just keep on scrolling. And then, you know, when you ask Michael about those lessons, here they all are. And you can, you know, collapse or expand those. And you can really see every single thing that's in here. And I'm not going to go through all that, but you can look at that. And then all of the participants that you just saw, they're all here. And then again, the learning objectives here. So, and I don't know if I mentioned the price, but it's $40 per student.